Good evening. My name is Leisha Neal. I'd like to start off by asking a few questions. How many of you have ever suffered from low back pain? Okay. How many of you have ever sought the care of a chiropractic physician for that pain? No one. Okay. Well, this evening I would like to share a little bit about chiropractic. I worked in a chiropractic office for over 22 years, and I witnessed firsthand a lot of patients come in with severe back pain, so severe that they were often bent over. But within a week of chiropractic care, they were not only walking upright, but they stated that they had little to no pain. Chiropractic dates back as far as the 1890s, and its founder was a Dr. Daniel Palmer. Dr. Palmer believed that if the body was kept in proper alignment and given the proper nutrition, it had the innate ability to heal itself. He also felt that all diseases were related to what he referred to as a subluxation in the spine. And actually, chiropractors believe, like the Word of God says, that the body is the temple of God, and if you keep it in proper care, that it will heal itself. Dr. Palmer had a janitor named Harvey Lillard who was deaf in one ear, and he told Dr. Palmer that it was from an injury as a child. And when he injured his neck, he heard a popping sound and later became deaf in his right ear. So the light came on for Dr. Palmer, and he saw that as an opportunity to put his theory to work. And so he adjusted Mr. Harvey's atlas, which is the first vertebra in your cervical spine. They heard a popping sound, and within 2 days, the janitor came back to Dr. Palmer and stated for the first time in years he was able to hear. Was it a coincidence? Perhaps. But it also fell right in line with Dr. Palmer's theory of subluxation. Now I have several cool visual aids here, and I want you to feel free to look at them after I'm done. But what I'd really like you to concentrate on is the human spine. I'm going to tell you what a subluxation looks like and show you through demonstration of the spine. This is a replica of the human spine. This is your spinal column, and it's made up of 24 vertebrae, which are the bones. Within each bone is a disc that is filled with spinal fluid. These discs serve as shock absorbers for any kind of physical exertion that's placed on the spine, kind of like a car has shocks. Then you have what are nerves coming out of the junctures of the vertebra. Well, a normal spine should have a slight curvature to it. Now, if it's straight or if it has too much curvature, see how the vertebrae are moved around? They'll actually pinch on the nerves. This is what you've probably heard people refer to as a pinched nerve in their back or neck. Okay. Well, this pinching or impingement on the nerve causes the nerves to get overstimulated. And once they do that, they send impulses to the brain. And these impulses tell your brain that you're in pain in the area that's being affected. Not only that, your muscles will begin to contract in an effort to protect the body from pain. And that's why you'll see people who have been in chronic pain for so long, they'll either be bent over because of chronic muscle spasms, or they'll tell you that they can barely move their necks because of muscle spasms. In an article entitled Effectiveness of Manual Therapies, statistics show that therapies used by chiropractors are effective for treatment of low back pain. Now, you're probably saying, well, what actually does the doctor of chiropractic do? The doctor of chiropractic performs on the spinal column what is referred to as a spinal manipulation. And it's just like it says. It's manipulating the vertebra to take that impingement off of the nerve. Now, this is done by placing the patient on a table, a flat, hard surface, and the doctor of chiropractic takes his hand and does a manual thrust on the spine. Now, he may need a couple of visits to realign these vertebrae, especially if they've been out of alignment for a long period of time. You may have heard people say, I went to a chiropractor and that doctor popped my back because they heard a popping sound. Well, no, the doctor did not actually pop their back. It would take a tremendous amount of force to actually pop a vertebra. But what they're actually hearing, remember I told you about the disc that go in between each vertebra that are filled with spinal fluid, they're actually hearing that friction between the bone and those discs. It's kind of like when you bend your knee and you hear a popping sound, where your knee isn't actually popping. That's the fluid that surrounds the joints. Same principle. In a journal published by Arch Intern Med, chiropractic is listed as the largest alternative medical profession behind medicine and dentistry. And so a final reminder tonight, I would just like to remind you all that if you're considering chiropractic as an alternative mode of treatment for back pain, you need to know one thing. Most back pain is not caused by a serious disease. A lot of people think if they have back pain, the first thought that comes into mind is a tumor or cancer. But most back pain is mechanical, or rather a dysfunction in the spinal column. And in my opinion, the chiropractic physician is both a spiritual and a natural side to healing. And if you think about it from the way that God created us, He did create the human body in such a way that if it was maintained, that it would have overall good health. Thank you so much for your time, and I hope that you will consider chiropractic as an alternative form of treatment for back care in the future.